Ventricular peritoneal shunting. Ventricular peritoneal shunting is a surgery to treat excess of cerebrospinal fluid, that is, CSF, in the brain.
What is CSF? Cerebrospinal fluid is a clear, colorless body fluid found in the brain and spine. It acts as a cushion or buffer for the brain's cortex, providing basic mechanical and immunological protection to the brain inside the skull. What is hydrocephalus? Hydrocephalus is a condition that occurs when fluid builds up in the skull and causes the brain to swell. The amount of CSF can increase when a blockage develops that prevents CSF from flowing normally. There is a decrease in the ability of blood vessels to absorb it, or if your brain produces an excess amount of it.
There are various causes of hydrocephalus. Some of them in adults include subarachnoid hemorrhage, meningitis, stroke, brain tumor, etc.
Options for treating hydrocephalus: conservative management, VP shunt, endoscopic third ventriculostomy, thecoperitoneal shunt. Your neurosurgeon will decide the best possible option for you. The procedure is done in Neuro OT of AIIMS. The patient is received in the receiving area and is shifted to the OT table. After giving anesthesia, the procedure starts. The procedure is done as follows. An area of hair on the head is shaved. This may be behind the ear or on the top or back of the head. The surgeon makes a U-shaped cut behind the ear. Another small surgical cut is made in the belly. A small hole is drilled in the skull and a thin tube called a catheter is passed into the ventricle of the brain. This can be done with or without a computer as a guide. It can also be done with an endoscope that allows the surgeon to see inside the ventricle. Types of shunt. Chabra shunt. It is available with AIIMS package of Rs 5,000. Bacticial shunt with Chabra valve. This can lead to decrease in shunt infection rate by 80%. Got an additional expense of Rs 12,000. Bacticial shunt with programmable valve. Additional expense of Rs 40,000 to 50,000, and this provides better regulation of pressure, especially in elderly patients. Anesthesia risk. It includes approximately 1% risk of life disability. Reactions to medications, problems breathing, changes in blood pressure or breathing rate. Surgical risk of ventricular peritoneal shunt placement are blood clot or bleeding in the brain, 2%, hole in the intestines or bowel perforation, which can occur later after surgery, 0.2%, leakage of CSF fluid under the skin, 2%, shunt infection leading to malfunction, 30 to 40% over 2 years, damage to brain tissue leading to weakness on one side of the body, 5%, seizures, 2%, inguinal hernia, and liver abscess. The shunt may stop working, and if this happens, fluid will begin to build up in the brain again.
Shunt replacement is usually successful in reducing the pressure in the brain. But if hydrocephalus is associated with other conditions like spina bifida, brain tumor, subarachnoid hemorrhage, etc., these conditions may also affect the prognosis. How severe is hydrocephalus before the surgery also affects the outcome. Revision of shunt or repeated shunt procedure may also be needed. The procedure is done in an operating room under general anesthesia, and it takes about 1 to 1.5 hours for the completion.
Before the procedure, if the procedure is not an emergency or if it is an elective procedure, tell your doctor or nurse what medicines, supplements, vitamins or herbs the patient takes. Take any medicine the doctor said to take with small sip of water, and be sure to arrive on time at the hospital. The patient will be kept NPO from 12 midnight. The patient will be asked to wear the hospital dress provided, and no other dress should be worn inside. You will be shifted to OT when the call is received from the OT. Once the procedure is complete, the patient will be shifted to ICU, and in ICU, the attendant is not allowed to stay with the patient. In case of any requirement, announcement will be made for the attendant. The attendant should wait in the waiting area provided. Children need to elevate the head end at 30 degrees for 24 hours the first time a shunt is placed, and after that your child will be helped to sit up. Once the patient is stable, The patient is shifted to ward and is admitted in the postoperative cubicle. Children and adults stay in the hospital for 2 to 4 days. The healthcare team will closely monitor the patient. IV fluids, antibiotics, and pain medications will be given if needed. Follow your healthcare provider's instructions about how to take care of the shunt at home, and this may include taking medicines to prevent infection of the shunt. Signs and symptoms of shunt malfunction. Signs and symptoms like headache, vomiting, lethargy, fever, etc. may occur if the shunt malfunctions. Report to your doctor if you observe these signs and symptoms.